This learning module addresses the indications for and the application of helium-oxygen mixtures in order to decrease airway resistance and work of breathing. We have access to tanks with 70-30 or 80-20 helium to oxygen concentrations. We'll refer to both of these as simply Heliox. Because Heliox is a gas that is less dense than room air or various oxygen concentrations, it can essentially slip past obstructions in the airway. In this way, a patient is able to ventilate and oxygenate under circumstances which they normally would not be able to. If you think of the obstructed airway as a thin tube, which would run through it more readily, a thick mixture versus a thin one? Any patient with a diagnosis that narrows the diameter of the airway, upper or lower, may benefit from the use of Heliox. While it is our policy that Heliox should be used in an ICU, exception to this rule is possible. Notify your supervisor and advise nursing the patient may be on Heliox while on the floor for a short period of time, during which the patient is to be kept close to the nurse's station until an ICU bed can be obtained. You'll find most Heliox here is utilized in the pediatric ICUs. ER does use it occasionally as well. And much like non-invasive ventilation, the use of Heliox can stave off impending respiratory failure until other adjuncts such as bronchodilators or IV steroids can take effect. Also like non-invasive ventilation, it's designed to be used in the short term for impending respiratory failure and works best when the patient needs a relatively moderate amount of help, rather than for the patient who is already in full-blown respiratory failure. We order our tanks from distribution. They'll want to know which concentration the doctor has ordered and where to deliver the tanks. Take into consideration your patient's required flows. You may need to order more than one tank. Remember to bring a tank wrench, and you'll need a Heliox regulator as well. Because pediatrics is the main user of Heliox, those units or their anterooms are a good place to look for a regulator if you can't find one. We no longer have to set up the Heliox circuit kits ourselves. We stock pre-made kits in the Davis 6 storeroom. They come with a flow mist neb and an attached non-rebreather mask. They come with either pediatric or adult masks. The above diagram is included in the Heliox circuit kit because the kit comes with the flow mist nebulizer included. The neb can be used for humidification or administration of a continuous albuterol nebulizer treatment. The pre-made circuit kits come attached to a non-rebreather mask. We don't want the patient to pull in room air around the mask, as that will dilute the Heliox. They also come with a rescue valve that will open so that the patient can breathe ambient air in case the tank runs out sooner than we expect it to. We connect the flow mist directly to the Heliox tank. The regulator should be set at about 50 psi. An oxygen analyzer should be placed in line with the alarm set in case the tank runs out far before we expected it to. Diluting your Heliox, even with pure oxygen via the auxiliary port, may actually make your SATs go down as the gas delivered to the patient becomes thicker, denser, and creates more turbulent flow. Studies show that 80-20 is more effective. Also, many vents these days that are Heliox compatible require you to use an 80-20 mixture. Studies regarding the concurrent use of Heliox and non-invasive ventilation are inconclusive. You can find as many to say that it works as those that say just pick one, concurrent use is no more effective. If you find you must deliver Heliox non-invasively, at this time you should use the Servo eye ventilator. We recommend you place the vent in non-invasive pressure control mode. And as always, when delivering non-invasive ventilation via a ventilator, you'll need to find the Respironics mask that does not have a valve in the connection elbow. It can be identified by the dark blue elbow. Right now we store them in the calibration room. Heliox passes through the flow sensors much quicker and with less turbulence than conventional gases, causing the exhaled volumes to be significantly inaccurate. Alarms such as technical cassette error may occur repeatedly. You will find that running Heliox through the Servo eye will cause a continuous oxygen alarm. The alarm can be silenced, but how depends on which vent you have and how it monitors oxygen levels. If your vent has an oxygen cell, you can go in through the biomed screen and choose to disable it. Enter the code 1973 and you'll find the Deactivate Cell option. If you're not sure if you have a cell, you can hit the status button in the top right-hand corner, even if the vent is currently running, and the screen will list the vent's various components, including whether you have a cell or a sensor. Disconnecting the sensor is a little more complicated but can be done. Of course, the vent cannot be on a patient running. Under the large rectangular body of the vent, just above the utility drawer, you'll find a lever that disconnects the vent's body from the stand and lets it slide forward toward you. Doing this exposes the above screw. One short turn and the screw pops up. Once it's popped up, the lid lifts up to expose the sensor. It may take some wiggling to get the lid off. It fits very snugly, but it lifts straight up and the blue sensor is clearly visible. The black connector essentially unplugs from the sensor and it's turned off. Replace the lid, again with a little wiggling, fits very snug. Replace the screw again with one short turn down with a little downward pressure. The screw is spring loaded, that's why it popped up before. So to get it back down, you'll have to press downward on it while you turn. The vent will now continuously show an alert that your sensor is not functioning, but the audible alarm will cease. Once in non-invasive mode, you can disable the minute volume alarm, but it doesn't get rid of the technical cassette errors. Different RTs have had different luck setting up the Heliox via the Servo. It's up to you which mode you choose. As stated before, if the patient is in non-invasive ventilation, you might find less errors occur if you're in pressure control non-invasive ventilation, but if the patient's intubated, the vent does seem more tolerant of the volume discrepancies. Again, the tank regulator is set up to about 50 psi, and you'll need the correct regulator. Whether your patient is in non-invasive mode or is now intubated, this is the proper setup. You'll need a Y going into the Heliox regulator that we call a cheater. On one side of the Y, it is ready to accept a high-pressure air hose. The other accepts a high-pressure oxygen line. The air line from the vent is plugged directly into the air connection on the Heliox cheater. This leaves the oxygen side of the Y available for an oxygen flow meter that can be utilized for bagging with Heliox or continuous nebs. The FiO2 setting on the Servo eye is then set to 21%. In this way, all of the gas the vent pulls to deliver to your patient is pulled from the Heliox tank, and the patient will get undiluted Heliox in whichever percentage your tank is in. The vent high-pressure O2 line is connected to the wall receptacle as usual. Moving your vent FiO2 knob away from 21% and towards, say, 30% will deliver a higher O2 percentage as it begins to pull oxygen from the wall source. But what this is also doing is diluting your Heliox. Again, as you dilute Heliox, it becomes less and less effective. Also be aware that when the valves open on the vent, it can create a significant pull from the tank. You can see this when the ball in the flow meter jumps as the vent begins inspiration, and that jump can sometimes result in an auto-triggered breath. If you're running the Heliox through a ventilator, you watch to see how fast your tank is being depleted, and then try and estimate when to order new tanks and how many to order. But if the Heliox is being run through a flow meter, you can do a little math and get a good estimate of how long your tank will last. Because Heliox is less dense, you may have to double the suggested flow rate on your nebulizer in order to produce the proper particle size. As with many nebulizers, you may have to adjust the neb flow rate for an acceptable mist output. The calculation is essentially tank factor times PSI divided by the corrected flow rate. This is a typical example of studies you'll find on the use of Heliox in that results are mixed. It's best to remember that Heliox itself can't treat bronchospasm, inflammation, or edema. What it can do is somewhat decrease the work of breathing in some patients. Some studies have found the same laminar flow of Heliox that decreases the work of breathing has other benefits such as increased deposition of aerosolized medication particles. Still other studies found lower PIPs on the ventilator, decreases in dead space ventilation, and auto-PEEP.